Well, hello and welcome to the first Encephalitis podcast of 2021 and the 11th in our series. I think it'd be right in saying it's been a very difficult first few weeks of the year for most of the world, but of course there is this glint of hope and positivity with the rollout of COVID-19 vaccines, and it is the subject of vaccines and vaccination, which is the focus of this edition of this podcast, where I'm delighted to be speaking to Professor Tom Solomon. Many of you will be familiar with Professor Solomon through his role as president of the Encephalitis Society, but alongside that, he's also the director of the National Institute for Health Research, Health Protection Research Unit in Emerging and Zoonotic Infections, head of the Brain Infections Group, professor of neurological science, honorary consultant neurologist, and a member of the UK government COVID-19 vaccine benefit risk expert working group. So all in all, I think you'll all agree that Tom's very qualified to talk about the COVID-19 vaccine. So Tom, thank you for joining us.
You're welcome, and thanks for that introduction. Of course, I should point out that although I sit on the expert working group advising the MHRA on vaccines, I am talking in a personal capacity today.
Look, talking of personal capacities, Tom, you had a bit of an unwelcome start to the year, having contracted COVID-19 in the new year. How are you?
Yeah, so more personal incapacity than capacity, and you're right. I'm doing fine. I had a very mild illness compared to many people who have very severe illnesses. I was just at home. But was laid up in bed for a couple of weeks, and still I'm not quite back to 100%. And it's always interesting getting up close and personal with diseases that you're studying. But what it did remind me is that we tend to focus on, quite rightly, on severely ill people in hospital who sometimes very sadly die. And we tend to think, it's just a mild illness for everybody else. But actually it wasn't, it was quite a severe, in terms of, it was like a bad flu. Knocked out for a few weeks and still not back to 100%. And I think that does become relevant when one's thinking about vaccines.
Yeah, I mean, I've known you for over 20 years and I don't think I've ever really known you to be poorly like that.
No, it's true. It takes a lot to knock me down normally. And also more than that, it takes a lot for me to admit that I'm not at 100%. And I do admit I'm still not at 100%. And I have sympathy for the many people who have had seemingly just a flu-like illness, and then it's taking a long time to get back to normal. And we know lots of viral infections can do this, and most people with a mild disease like that do get back to normal, but it can take some time. So it's giving me a lot of sympathy for some of my patients.
Well, that's always a good thing for our doctors to have empathy for their patients. So, look, when we announced that we were doing a podcast around vaccines, have been absolutely inundated with questions from people around the world. Many of them, as I'm sure you can understand, have concerns about vaccination, especially if they're recovering from encephalitis or undergoing immunosuppressant treatment. So I thought what we'd do for this podcast is start, I think, naturally at the beginning and talk a little bit about the vaccines themselves, and then go into some of the more personalized questions that have been sent in. But our first question is from Lucy, who's one of our volunteers, and she says, please could Professor Solomon explain the process of how vaccines are made? How are they different from one another? How are they the same? And what's the science? Why is the science behind it not new?
Thanks. I mean, clearly this is a question we could spend the whole hour answering just this one question, but we won't. I'll try to keep it simple and short and say that to understand the difference between the vaccines, you have to first of all understand how a vaccine works and what it's trying to do. And to understand that, you have to understand a bit about how the body fights infection. And in summary, when we get infected with a virus, the way the body fights it is with things like antibodies that latch onto the virus to stop it causing trouble, and things like T cells, which destroy the virus as a whole, if you like. And that's the body's natural response to an infection. And what a vaccine is trying to do is to mimic that response. And the way we try and mimic it is by showing it something that looks like the virus, but is not the full nasty virus. And there are different ways of doing this. So in the past, with things like polio, what we used to do was show the body the polio virus that had been killed. So early polio vaccines were just killed polioviruses. And what that meant was that the body saw the virus, developed an immune response to it, developed the antibodies, etc. And then when you got real polio, your body was ready to defend you. That's the essence of vaccination. So those are the old vaccines, were things like killed virus, or the other way to do it was just to get a virus and modify it. So it was still a live virus, but it was so weakened that it wouldn't cause you any harm. Those are the two old types of vaccine. These newer vaccines for COVID-19 are different, but the basic principle is the same. And the basic principle is to show the body this spike protein, which sits on the outside of a virus, show it just the spike protein. So then the body starts to make defenses, antibodies, etc., T cells against the spike protein. And that means when you get the real virus infection, your body can deal with it. And just to finish off, the two vaccines that we have in the UK at the moment, the Oxford AstraZeneca one uses a technology that's a new technology, but it's been used on thousands of people already in trials. And that is basically putting this critical spike protein into something called an adenovirus vector. It's just a way of getting it in. Whereas the Pfizer vaccine, what it does is it just takes the genetic code for the spike protein. It's like the instruction manual, and it puts that into our body so that we make just the spike protein. And then again, the body says, we'll create immune defenses against that spike protein.
Thank you. One supporter said, can a vaccine be totally safe if it only took a year to develop? How would you respond to those concerns?
Well, nothing in life is totally safe. No vaccines that are given are totally safe. No drugs are totally safe. No drive to the shops is totally safe. It's all about relative risk. It's how safe is it compared to other things. And so I think the question really here is, can a vaccine that's been made in a year be as safe as vaccines that normally take 10 years to make? And the answer is yes, it can. And the reason why it is as safe is because it's gone through all the same processes. But in normal vaccine manufacture, we do the first step, which is creating the vaccine, and then we put it in cell lines, and then we put it in animal models, and then we do it in a small number of humans and then a larger number of humans. And this is why it takes so long, and there's lots of steps, regulatory steps between all of those. But what we've done for these vaccines is done some of those steps in parallel, and then also speeded up the regulation. And so the committee, the MHRA working group that I'm on that advises the MHRA, normally those things take weeks and months, and we worked our socks off to get it done in weeks. And the analogy I draw when I was trying to explain this to people is with getting through the airport to get on a plane. You get lots of security checks, safety checks, your bags are checked, you go through the screening, okay? And it normally takes most of us a couple of hours. If you're a business class passenger, you can whiz in and jump the queues and get there in half an hour. And so but there's nothing, you wouldn't say, oh, the business class passengers are more likely, the risks are greater from them. It's just a speeded up process, but with all the same steps.
Oh, thank you. Well, Tricia wanted to know, I think linking into that, Tricia asks a question. She said, are there any risks, though, to the COVID-19 vaccines? Can it cause outcomes such as encephalitis, for example?
Well, there are risks to vaccines, and it's all about the benefit versus the risks, and that's what groups like the MHRA group is all about. But there are no cases of encephalitis caused by the vaccine, as far as I'm aware. But of course, there are cases of encephalitis and other brain problems caused by the virus. So that's why the benefits of the vaccination outweigh the risk. Certainly in terms of, if you're worried about encephalitis, the benefits are clearly beneficial to take the vaccine.
Well, look, I'm curious, on a personal level, about your perspective on vaccine hesitancy, or vaccine confidence, as it's more commonly called these days. What do you think about it? What drives it? And what, in your opinion, should we be doing to address it? Because this is a topic that I'm actually very passionate about personally.
Well, again, it's another massive topic that we could spend a whole hour talking about. I think we have to distinguish the vaccine hesitance from the anti-vaxxers. So I see people who are anti-vax are those who have passionate beliefs against vaccines, against all vaccines, and they're based on false premises. Basically, they don't really want to look at the science or address the science. They just have a passionate belief, and they'll say anything they can to enforce that. I think vaccine hesitancy is just people thinking about the things, and vaccine confidence, that we've just been talking about. It's about risk versus benefit. So, anyone who has a vaccine, whether they consciously do it or not, they're thinking, are the benefits of this greater than the risks? And all the data show that the benefits are massively greater than the risks. But I think people are right to give it thought. And I think we have to be careful, as those who believe in vaccines, not to sort of dismiss or poo-poo the hesitance. People are right to look at it and think about it. But the vast majority of people who look at it and think about it will want to get vaccinated.
Yes. Well, we've had a few questions around whether the COVID-19 vaccine is safe to take at the same time as other vaccines, such as the flu vaccine. So we've got a couple of questions around that. This is from Joanne, who tells us, 6 years ago, my child nearly died from acute necrotizing encephalopathy. From a flu A virus. She's almost 13 years old now and has the flu vaccine every winter. Is the COVID vaccine recommended for her? And if so, which one would be more suitable?
Well, I'm really pleased to hear that Joanna, her story, her child's story, really exemplifies it. She had a very nasty illness caused by a virus, and then subsequently took the vaccines to try and prevent that virus coming back. So the specific question, the COVID vaccine, yes, it is suitable. It's not we call them contraindications. That's the term meaning reasons for not having the vaccine. And there are a couple, but having had that illness in the past is certainly not a contraindication.
Okay. I'm particularly interested about this next question, which came from Kathleen. She said, I was told by my neurologist to not put anything in my body for 2 years after encephalitis, so no flu jab, but my GP disagrees. I've decided to have the flu jab as side effects of influenza can be encephalitis, and I don't think it's worth it. I wonder if this is the same with the COVID-19 vaccine.
Well, a previous encephalitis is not a contraindication to not have the vaccine. And I think clearly different doctors have different perspectives. If you're a neurologist, you see people with neurological diseases. If you're a GP, you have to look after everyone. And it's really GPs that make decisions about vaccination. And they're the people who do it all the time. Neurologists are not. So, I'm glad to hear that this person should go ahead and get the vaccine. And just to make sure we've answered the first thing you mentioned, which I don't think I answered, was about, is it safe to take the COVID vaccines at the same time as flu vaccines? And in fact, we don't recommend that. And basically that's because there's no data on that. People haven't done them. There's some suggestion that if you have one vaccine and another soon afterwards, then you may not get quite as strong an immune response. So we usually say separate the vaccines.
Okay, thanks. Shortly we're going to move on to some more specific questions that people have sent in and that our support team at the Encephalitis Society are fielding. But just before that, some more general questions that have been put to us. People want to know whether you can still get COVID-19 after vaccination or even transmit COVID-19 after you've been vaccinated.
Yeah, that's a good question. So no vaccine gives 100% protection forever. The COVID vaccines are giving sort of 70, 80, 95% protection. And what that means is that unfortunately, some people who will be vaccinated won't be protected. That's just always the nature of a vaccine. So yes, you can get COVID even if you've been vaccinated. And what the other recent data show, and you might expect this, is that the vaccination protection drops a little bit slowly over time. So we know now that it's good for 5-6 months, etc. But over time, the protection will drop a little bit. But of course, it has protected you from disease during all those months. The other really important question is does the vaccine stop transmission? Again, the perfect vaccine would protect me 100% forever against disease, and it would also stop me ever passing the disease on. But again, there are very few examples of that, and it's now looking as though COVID-19 vaccines, they don't stop transmission. They probably reduce transmission. Again, the data are not quite there yet on this, but given that most transmission is from people who are coughing and spluttering over each other, you can see that if you have the vaccine and that stops people getting sick, then transmission will probably be reduced, even though it doesn't get rid of it altogether. But the really critical point is that we want to vaccinate as many people as we can, as quickly as we can, because even if it doesn't stop transmission altogether, it brings it right down. And this is where this recent issue over variants, mutations of the vaccine becomes important, because we know that this is happening. At the moment, the vaccine is still good for all the current mutations as far as we're aware, but it may well happen that eventually we do have mutations that are escape the vaccine. And that's much less likely to happen if we've got on top of transmission. If there's much less virus around, there's much less chance of these escape mutations happening. But I should say, on a reassuring note, that even when they do happen, if they do happen, and they probably will happen eventually, it will just be a matter of us adjusting the vaccines. And we may well end up in a situation where, a bit like flu, where we are vaccinating vulnerable people every year, but it very much, we have much less disease than we have now.
So it sounds like in the interim, until we know more, it's important that even if people have been vaccinated, then that they continue to wear their masks and socially distance. So people should continue with that. But one person wanted a takeaway explanation that they could give to friends and family about why they should take the vaccine. What, in a sentence or two, what would you say?
I think there are 3 reasons to take the vaccine. 1, it will stop you getting ill. 2, it will protect others. And then 3, it'll get rid of this damn pandemic with all the lockdowns and restrictions, etc. If enough people take it, there'll be less disease and we'll be able to ease up on the restrictions.
That sounds like a good enough reason to me. Well, in this next section, we're going to look at some questions that centre around viral encephalitis before moving on to autoimmune. This first comes from Emma and echoes many others that we've had around which vaccine would be most suitable for people who've had encephalitis. So she asks, I had viral encephalitis 1 year ago. I also had COVID-19 after Christmas. My GP has told me that I'm not classed as vulnerable and am in group 6, so a moderate risk. However, I'm on epilepsy medication from the infection, as encephalitis doesn't appear on any of their lists. Which vaccine would be the preferred for an encephalitis survivor?
I think the answer to that is the preferred vaccine is whichever you can get sooner. So there's no data at all to suggest any differences in terms of encephalitis survivors, whether one or other would be better. And I think people should really be taking the vaccine at the soonest opportunity, because that will provide the protection that they need.
That sounds good. We had a similar question from a gentleman who had herpes simplex viral encephalitis twice, and he wondered if his immune system, his immune response to the COVID-19 vaccine will give him the protection that he needs.
Yes, it should do. As I mentioned earlier, there's a small number of people who get the vaccine and don't develop the immune response to protect them. But that could be anyone. There's no reason why he should be any less likely to get protection than anybody else, even though he has had these serious illnesses in the past.
Well, another question around herpes simplex encephalitis came from Julia in California. And she says, my boyfriend had encephalitis about 2 months ago, and I'd like to know if you guys recommend for him to get the vaccine.
That's a simple one and a quick one, yes. But what I would say, assuming he's now, making good recovery, so he certainly should get the vaccine. One of the, but if somebody has an intercurrent illness, if you've got a cough or a cold or a flu at the moment, then we would usually say don't take the vaccine until you've got over that. And the reason for that is very simple. It's just that we don't want to be confused by, somebody's had the vaccine and then they have a bit of a fever, and then there would be confusion. Well, was that due to the vaccine, or was that due to the illness that they already had? So that's really why we like people to be healthy, not have that kind of intercurrent illness before they get the vaccine. And also, I should say 2 other very important things, which I really should have said at the start. I'm a neurologist, as you know, Ava, and I do research on encephalitis and have done research on vaccines as well. And even though I'm sitting on this committee, it doesn't really put me in a position to give expert advice to individuals in terms of their vaccine risks. And really, the people they should be talking to, of course, are the people who are going to vaccinate them, which might be the GP or the vaccination centre. And in addition, people can get information on vaccine risks from the government website, etc.
Yeah, no, that's a really good point. And I think although people have sent in these questions about their specific circumstances, the answers are broad, I think, that we're looking about, because you can't consult on individuals. We understand that. And also alongside this podcast, we're getting a vaccination consensus statement, which has been put together with yourself and other members of our scientific advisory panel. And that will have links to other sites that people can go to get some of their queries answered. But it also makes the important point that you did, which if people have got specific queries, they must speak to their own treating physicians and medical teams. So this is a question from someone, I don't even know if I'm going to say her name right, Anya, A-I-N-E. That sounds maybe Irish or something. I'm not sure if I've pronounced it, so I'm sorry if I haven't. She says, I'm 20 years post herpes simplex encephalitis, now 42 years old. I've had the flu vaccination for the last 5 years with no issue, and very happy to take any preventative measures to safeguard my health. We're very pleased to hear that. I'm chronically fatigued with temporal lobe epilepsy and associated hearing loss. Is there a preference for vaccine type? I'm a frontline worker, so due to get the vaccine in the next few weeks. The Pfizer vaccine is the only one currently available here. The mRNA vaccine seems like the logical choice. Of course, since we've had that sent in, of course, we've got both AstraZeneca and the Pfizer vaccines out. I think you said earlier, actually, I think we've probably answered this, that actually take whichever one you're offered.
Yes, I think that's right. The mRNA vaccine is the Pfizer vaccine. That's the same thing. The AstraZeneca is the Oxford one. We don't know where this question's come from. And indeed, there are other vaccines in America. The Moderna vaccine is available, which is another mRNA vaccine. But I think you're absolutely right. I mean, it's great to hear that this person does get their flu vaccine every year. And it sounds like they will be getting the Pfizer vaccine. And I would certainly get that as soon as you can.
Yeah. I have to say my husband was vaccinated on Christmas Eve, and it felt like the best Christmas present ever, really, that we could have had. So we've had lots of questions around autoimmune encephalitis, COVID-19, and this first one is from James, and he says, I'm on immunosuppressants following autoimmune encephalitis in 2016. As a result, am I more susceptible to COVID-19? And would a vaccination against COVID-19 still be advisable?
Well, it's a good question. So there are data, there are basically two types of data in terms of risk from COVID-19. There are some where we definitely know these populations are at increased risk of severe disease. And that includes the people who are very old, also people with obesity, and also, interestingly, people who've had solid organ transplants and are on immunosuppression after that. So, that's somebody who's had heart transplant, kidney transplant, and are on very strong immunosuppression after that. And we know from studies such as the Zoonotic 4C study, which is a brilliant national study with more than 80,000 patients in, that's being led by one of my colleagues from Liverpool, and is supported by the Health Protection Research Unit that you mentioned I'm the director of. And that study has shown quite clearly that people with solid organ transplants on immunosuppression are at increased risk of severe disease. So that's one group. There are people we know definitely are. And then there's a second group where there's no strong evidence, but where you think, well, it might be, it's plausible, and it may be that they're at increased risk. And I think this person, being on longer term immunosuppression, even though it's not very strong as organ transplants, they may be at increased risk of severe disease if they get COVID. And therefore, that's even more reason for them to get vaccinated as soon as they can.
Okay. Well, similar but slightly different. Jade asks, she says, I was wondering if there was any evidence regarding getting the vaccine and having had anti-NMDA receptor encephalitis. Even though I haven't been on any immunosuppressants for years now, I'm concerned about whether the vaccine will fight with my antibodies or will it be beneficial to me?
Thank you. So this is somebody who is no longer on immunosuppression, so that they've not been on it for years, so that issue doesn't really apply. But the question is, could the vaccine in some way interact with the NMDA receptor encephalitis, which, as you know, is all about antibodies against the NMDA receptor? And there's no reason to think that at all. So, as we talked about earlier, what vaccines do is stimulate an immune response against whatever's in the vaccine, in this case, the spike protein. And so I wouldn't think there's any reason for this person not to be vaccinated.
Right. Well, we had a similar question in from Hannah and Debbie, and I suspect you'll say that the answer you just gave is the same, but I'll ask it nonetheless. They said the vaccine creates antibodies to keep us safe from catching COVID-19. I have autoimmune encephalitis. If my body incorrectly creates antibodies to attack my brain, could the same thing happen to me if I take the vaccine?
Well, in autoimmune encephalitis, for example, NMDA receptor antibody encephalitis or other forms, we don't know what triggers these antibodies to form against the brain, but there's no evidence at all that vaccines are a trigger. People have looked into potential triggers. There's nothing to suggest that at all in NMDA or other types of autoimmune encephalitis. So for that reason, we wouldn't say that somebody should not get the vaccine.
Okay. Well, in a minute, we're going to move on to some more general questions, but this final question is from Ray, and it's about his son. And he said, my son had limbic encephalitis 10 years ago, and now, due to the steroids used, is steroid dependent. He's a senior charge nurse and currently shielding. The vaccination centre consultant would not administer the first vaccine jab due to the impact it may have on his T cells. So I'm interested, he says, to see the outcome of this. Do you have any comment on that?
Well, again, steroid usage is not a contraindication to getting vaccinated. And as we talked about earlier, somebody like this may actually be at increased risk of severe disease. So I would think this is somebody who should be vaccinated. But again, you can get expert advice on vaccination, either from GPs or for some people who have immunosuppression, etc., they will consult with immunologists.
Yes. So whoever's still prescribing the steroids, he should probably go back and talk to his treating physicians.
I think so. Yeah, I think the person prescribing the steroids, they obviously they'll know how much they're giving and the impact of this. But being on steroids is not a contraindication to getting vaccinated against COVID-19.
Okay, thanks. Well, our support team have also been fielding inquiries from members who are caught between the guidance that they're receiving from their family doctor and the guidance of their consultant. So these are mostly applying to autoimmune cases and those with post-infectious encephalitis. And the first one is when someone is getting conflicting advice from their family doctor and their neurologist, what do you recommend they should do?
Yeah, we talked about this a little bit earlier on, and it's not helpful for patients at all when there is conflicting advice. One thing I think is that sometimes it's just that messages are getting a bit lost along the way, and so I think it's helpful to have written, if you've seen your neurologist or your GP, to try to get written, evidence from them, as it were. Is this what they were really saying? And clearly to try to get them to talk to each other. But neurologists see neurological patients and are experts in looking after people with neurological disease. And although they mean well, they may not always understand fully the vaccine risk-benefit ratios, etc. GPs are, one of their jobs is to vaccinate people and to think about risks and benefits, etc. So it can be difficult, but I think the key will be to try to get different people to talk to each other.
Thank you. Well, look, thanks, Tom. Look, the NHS is under considerable strain at the moment. It's the main reason that we're suffering further lockdowns around the world. So I think we're all resigned to a tough 2021, at least in this, first half of the year. I guess the final question I want to put to you is there light at the end of this pandemic tunnel?
Well, clearly, Yeah, gosh, it's been a very difficult year. 2020 was a tough year for everyone, for all of us. And, I think what's been especially tough is that towards the end of the year, we had the announcements of the vaccines. We thought we were there. We thought we could see a way out of this. And then, of course, we got the new variants, which are more easily transmitted. And also now there's some evidence that they might cause more severe disease. So, that was a real kick in the teeth, I think, for all of us, when it looked like we were getting there. But what I would say is the vaccines are rolling out tremendously well, especially in the UK. It's a brilliant effort from all the way through, from the people who made the vaccines and now through to everybody who is administering them. And clearly during this pandemic, there are some things where maybe the UK has not done so well. But I think in terms of making vaccines and getting them rolled out, we have done really well. And as the numbers of vaccinated go up and up and up, then we will get this under control. And, eventually we will be able to ease up on these restrictions. And life is not going to return back to normal like that. And, we may never get back to life exactly as it was beforehand, but we will be able to start doing all the other things that we have done in the past. So, I think it's really important that people remain optimistic. And, thank heavens we do have things like the vaccines, because, ultimately that's going to be the way out of this.
Yes, no, absolutely. Good point. I think am I right in thinking the last time you and I were on our travels out of the country, we were actually together? I think that was the last time we left the UK, wasn't it? We were in Geneva at the World Health Organization, probably nearly a year ago.
That's right. Yeah, that was my last work trip with you, and we were in Geneva. We were talking to the WHO actually about encephalitis, why it's important, and also including vaccine preventable forms of encephalitis like measles, like Japanese encephalitis. As you know, in Asia, this is a big problem, but we've had massive inroads through vaccination campaigns to reduce the numbers of this terrible type of encephalitis. Measles encephalitis, and we shouldn't see that at all anywhere in the world, but unfortunately we do, because we still see measles. So yeah, and it was in February, I think, and the outbreak had started, and it looked like it was going to get busier. And it's been a busy and difficult year, but ultimately organizations like the WHO are there to help coordinate health protection around the world. And I'm glad we have organizations like that to help us deal with problems like this.
Yeah, absolutely. And as you know, we've done a lot more work since that trip. I think that was your Christmas reading, wasn't it? I'm sure it was the last thing you wanted to do, but I think I gave you some weighty tome that we've since written. So people can watch this space. We'll be doing a lot more work, following that visit and those discussions with the World Health Organization.
Yeah.
Look,
of course, the last time we were together in the UK was when things were a bit easier towards the end of last year, and we had the Encephalitis Conference, which again, I think that's a really good example of how, we are adapting, people are adapting. Normally, we have a couple of hundred people at the Royal College of Physicians. For this conference, people couldn't travel. So we just had a few of us who are actually presenting and managing things, but we rolled it out virtually internationally, and we had a bigger audience than we normally do. So, when we talk about things returning to normal, some things will be better than they were before the pandemic started. And, I think there will be many positives.
Yeah, 100% agree. It really pushed the society and our team to create, as you described, this hybrid event. So, of course, we want to be in person, and I hope that this year we will be. But as you said, actually going digital, creating this incredible event, I have to say I felt a bit sick at the beginning of that morning. It actually went really, really well. And we were all so relieved and pleased at the end of the day. But I was writing a report yesterday for one of the funders, and by going digital, we increased delegate numbers by about 30 or 40%. and increased by, I think it was 25%, 24%, the numbers of countries that participated. So, we had 34 countries online with us that day. And now, even if the pandemic stops, we wouldn't just say this is an in-person conference. We won't go back to that. It's going to be digital and in-person going forward. And so it's pushing us to do things.
Exactly. And the other thing I was thinking about this morning was World Encephalitis Day, which is, of course, on the 22nd of February, 222. And, again, in the past, we've had some great events with lots of people together. The first one in, I think it was 2014, we had the world's largest brain, several hundred of us crammed into a tight space to make this image of a brain and get our Guinness World Record for it. And, that was great fun at the time, but clearly we couldn't do anything like that this year. But we're doing the lighting up the buildings in red all around the world. And, again, it's a great way of raising awareness that doesn't involve people packing in tightly together. And it's about us adapting to do things differently. And you may have heard, we've just heard that the Liver building in Liverpool, this iconic building, we're going to be able to light that up in red this year. And we hope that people will we know people are doing similar all around the world. And I think if anyone is interested in lighting up their local iconic building and wants a bit of support, they can find that support on the website.
Absolutely. If they go to worldencephalitisday.org, and my team are there to help. We've got people all around the world have mobilised getting these buildings lit up. As you said, you and your team managed to get the fantastic Liver building in Liverpool. We've got Niagara Falls lighting up. We've got Toronto City Hall. The 4 Danube bridges across Vienna are lighting up. The sails in Vancouver. So all around the world. But
also I also, as well as those iconic buildings, I think this is a challenge to people. I want to see as well, there might be 20 or 30 of those, but I want photos of 222 buildings lit up in red. It might just be your own house. It might be your bedroom lit up in red, but this is a challenge to the many people who follow the Encephalitis Society to light something up in red and send the photos in. And I can just see it now, 22nd of February, 222. I want 222 photos of buildings or things lit up in red, and it'll be brilliant.
Well, I'll let you tell my team 222 because I think they'll probably have a nervous breakdown. But yes,
but all our followers, come on, all of our followers and supporters all around the world. Surely anyone can find something to light up in red, even if it's just their little teddy, like I have here. Sorry, Peggy's been chewing this, but get something like this, light it up in red and send us a photo. It'd be brilliant. And then everyone can get involved.
Absolutely. So, well, that's your challenge, everybody. February 22nd, World Encephalitis Day. Get your local landmarks lit up. And if you can't do that for whatever reason, light up your own house red. And of course, wear something red and share your photographs on social media using the hashtag World Encephalitis Day and hashtag Red4Wed. Well, look, we really hope that we've answered many of your questions. If we haven't or you're concerned about anything at all, please get in touch with the Encephalitis Society team and we'll do our best to help. Don't forget that the Society team and services remain open and at your service. If you've enjoyed this podcast and can support our work, please do so at encephalitis.info/donate.
Would it be, Ava, would it be terrible of me to also mention the Scouse Science podcast? As you know, I do a lot of chatting about science in an informal way. And if people have enjoyed this, then search for the Scouse Science podcast, on which we will be getting you, Ava. You are on our list of future attendees, which will be great. But that's another, for people who like to listen to a lunchtime podcast or listen to it on their podcast providers, Apple, Google, etc. Then listen out for those. And as you know, we've had some great guests. We've had Andy Bear, the Greater Manchester Mayor. Andy Burnham, I'm sorry. You see, that's the COVID brain fog. I'm still not 100%. Jane Garvey from Woman's Hour. We're getting Michael Burke coming on soon. And we will even be having the famous Ava Easton at a future event. So listen out for those if you want to. You had
Stephen McGann on as well. I was a little bit jealous. I would have liked to have been on with him.
He was brilliant. Yeah, the doctor from Call the Midwife. He was fantastic. So it's a lot of fun, and we talk about science and we also talk about society.
Absolutely. So that's the Scouse Science Podcast. So Google that, it should come up. But look, we're at the end. All it leaves me to say is once again, thank you to Tom. Everybody, please stay safe, wash your hands, wear a mask, and stay socially distant. Thanks, everybody. Thank you, Tom.
Thanks. Bye now. Cheerio. Bye.